Hello and welcome to this week's Talk of the Town show. We have a great show planned for you, so we're going to get right to it. I would like to introduce Dr. Jeff Aberle with Aberle Chiropractic Clinic right here in Madison. And we're going to talk today about restoring your health through chiropractic work. So let's get right to that. What is the common question that you hear from your clients over and over as far as how you can help them with their health?
Well, I can help them in a lot of different ways. Most people come to a chiropractor usually because they hurt. They're in some kind of pain and they want it gone. But I can do a lot more than just that. So let's say somebody comes to me with neck pain or low back pain or a hip problem or something. And you point out what's causing that, and it's usually a structural problem and a postural problem. But then you also point out that they're not breathing well. And you have them take a deep breath in, and they work like crazy to try to get that breath in. And after you get done treating them, and I get everything lined up the best I can that day, and they can breathe better. They can take a deeper breath, so that's nice.
Right.
It's really neat for athletes. Athletes love this stuff because they can actually get more air into their lungs with every breath. Their posture pops up, their shoulders are back, and they're not working at it, because you look kind of silly if you're trying to hold your shoulders back and be macho-like, right? So with this type of work, you restore posture in a natural way, and you get rid of people's pains at the same time. It's wonderful.
You bring up a great point. A lot of people might not know the difference between a chiropractor and a medical doctor because you work on so many more things, as you just said, than just the back.
Yeah, exactly. Yeah, it's two different professions, and you really need both of them. Chiropractors deal with structure, they deal with posture alignment, they deal with breathing. A lot of us also focus on nutritional stuff, improving the diet, taking nutritional supplements, enzymes, digestive function. So there's a lot of natural stuff there. The medical doctors tend to work with prescription medications, they work with over-the-counter medications, surgeries. So there's different ways of looking at health. Now it's interesting because both professions oftentimes treat the same things. It's just totally different methodologies about how to treat it. Mm-hmm. And so that's kind of the big difference between the two.
Let's talk about some of your treatments and your methods for getting there, because people sometimes just believe, all right, I'm going to go in, I'm going to lay on this table, and they're just going to crack every bone in my back, and they're going to make me feel better. But you really kind of go the safe method, and tell us about that method.
Well, see, here's what fundamentally goes wrong in the human body, is that bones, in your spine, if they get shoved forward, there is no muscle to pull that back.
Okay.
That is the fundamental thing that goes wrong in the human body. And so when that gets shoved forward, you've got to push that back because there's no muscle that can physically do it. We just don't have muscles that can do it. And the simplest thing is, do you ever crack your knuckles?
I do,
do you?
Unfortunately.
How do you do it?
I twist them from side to side.
Okay, do you ever pull them?
No.
Okay, you twist them from side to side, right?
I do.
Now, do it without this hand.
Go ahead. I can't.
You can't, right? Why?
Because I need this one to help.
You need a muscle to do that,
right?
Right? And so when you crack your knuckles, you need something else to do it. Now with your fingers, you have your other hand to do that.
Sure.
But how are you going to do that with your back?
Yeah, you can't.
You can't do it. I can't do it myself. It drives me nuts if something's out on me and I'm like, oh man, if I could just,
If I could just go see a chiropractor.
Yeah, but I need somebody else that can get the leverage to do it and move it back in place. So you don't have to crack everything. It's not like you go face down and you crunch everything. In fact, I don't even put people face down. My adjusting is done up against the wall. The person gives themselves a hug. I come and hug them. I have my hand behind the back, and I just give them a little push up against the wall. And then that pushes the bone back into place. Very, very simple. So there's more to it, but it's also that easy.
That makes a lot of sense. Now, do a lot of your customers feel better instantly? Is it that instant gratification, or is it, all right, in a couple days, you're going to feel this and you're going to feel much better?
It's most of the time it's instant. They're
wow.
Like, oh, that kind of a sensation where they're like, yeah, that's exactly what I needed. So that's what I love about it. And people usually, their first visit, it's eye-opening for them because they're standing up, they can't slump. My definition of when people are done is I'm looking at it from the side, they're standing up, right? I have them breathe in, they take a deep breath in, they let their breath out, and they let their bodies relax. And if they slump, I know I missed something.
Wow.
Okay, it's that profound. And so their bones, your bones are supposed to hold you up, not your muscles.
Okay.
So there's this big myth out there that, you got to strengthen, you got to do all this core stuff. Don't you hear that?
Mm-hmm.
Your core exercises to get your posture better. If you get the bony alignment back in better positions and you unwind the person's frame, the posture restores up on itself, and you just don't have to use your muscles to hold yourself up. It's the neatest thing.
One more last question. I just want to talk about the people who have other issues other than just their back. They may have headaches. They may have other things going on in their body. There's a chance that chiropractic work can help whatever they are facing.
Huge chance. Yeah, it's a huge possibility. It's basically, the simplest way you can say it is, as long as your pain is not coming from cancer, infections, or fractures, then I'll probably be able to correct it on you. Okay, and most people know if they have cancer or they have pain from cancer.
Sure.
Infections, most people do not have bone infections, which is the painful one. And broken bone, you know if you have a broken bone. So most of the things, headaches, neck pain, shoulder problems, back pain, foot problems, knee problems, it's this whole laundry list of different complaints that you can get, because when you start restoring the structural integrity of the body, all that stuff just fades away.
Great insight. Thank you so much. Dr. Jeff Aberle, Aberle Chiropractic Clinic. You want to go see him for any problems you may have. More Talk of the Town is coming up right after this.